Some of the signs and symptoms of tongue tie can be mistaken for other things. And so you have a really colicky or extreme fussy baby. Sometimes it's because they're sucking in a lot of air. Every time that tongue unlatches and you hear that click, they're actually swallowing air. So they're really gassy, they're really fussy, they'll have excessive hiccups, or they'll choke on your milk supply. Because what happens is, a lot of times it could be your milk supply is really strong and it's just flooding your baby, and your baby doesn't have the ability to keep up with it. But most often than not, it's that your tongue can't lift up. So the tongue will lift up when that milk is coming and they need rest. So let's say, I need to not feed right now. They'll rest and they'll block that milk. Well, if they can't do that movement in the back of their throat, they can't block the milk, and it just, they have to chug. They'll develop excessive hiccups or choking. A lot of times they'll spit up a lot, or they'll be diagnosed with acid reflux, be put on medication, because it's just coming straight into their stomach, and they're not able to slow down the process. We'll have babies that have prolonged or frequent feeding. So prolonged meaning it's lasting more than an hour. So anytime that someone says, I'm feeding for about an hour, 45 minutes to an hour, I start to have the red flags of something's going on here. Frequent feeding. So I'm not talking about cluster feeding. I'm talking about every single feeding is sooner than 2 hours. If we're having a baby who's feeding every hour, every half hour, what they're doing is compensating for the fact that they can't effectively pull the milk and what they need at that moment. Some of these babies will latch and unlatch, so they get onto the breast and they'll get a good latch, and then they'll lose the latch. They'll get back on, and then they'll lose the latch. And it's because that tongue isn't able to seal appropriately, and it pops off. A lot of these babies will need nipple shields to actually grip on. It gives them something tangible to grip onto. And so the nipple shields are actually what we use to help these tongue tie babies. The other thing too is that they can cause significant nipple pain and damage. Because when a baby wants to come at the breast and they don't have the jaw movement because that tongue isn't able to use that big movement because of that tissue, they're going to come at the breast with a very shallow latch. They're not going to open wide for that latch, because as soon as they do that, that tongue gets pulled down and it can't do what it needs to do. It can't seal, it can't move the way it needs to. So they pull back and they will come at you with a little shallow latch, which means that your nipple is right at their hard palate and they're just biting you the whole time. At the very beginning, they might have excessive weight loss. So these are the babies that weren't able to stimulate that milk supply because of a tongue tie. The tongue wasn't able to do what it needed to do. So the milk didn't come in time, or when it came, they weren't able to pull the milk out. And so we see them back in the clinic at 10%, 11, 12% weight loss. And so we have to get them on these programs to supplement them and to get them to start gaining weight. Sometimes they'll gain weight really well, and then they'll do a very slow weight gain. And that's because maybe they're taking in 75% of what they need, but not the full extent of what they need.